Hi everyone, my name is Ashley and I'm from Healthwatch, Wolverhampton, and on Thursday it's Time to Talk, and Time to Talk is all about encouraging people to have conversations around mental health, and that can be in a whole range of different ways. So that could be opening up more or talking more about your own experiences of living with a mental health condition. It could be talking to your friends, your family members, your loved ones, and encouraging them to seek support, or just being there for them if you know that they're struggling. And it could also be just having a general conversation about mental health and helping to reduce some of the stigma that is attached to it, because unfortunately there is a stigma around mental health and we don't think about it in the same way that we do physical health. So, if you're ill or you hurt yourself, you go to the doctor or you go to hospital and you get it seen, you get it sorted. And quite often people will talk to their family members and their friends about the fact that they've been to the GP or that they've spent so many hours in A&E. And we don't have the same conversations that we would, with mental health, and we really should. We really need to start thinking about it in the same way that we do physical health. And, often they're interlinked. Bad physical health can lead to poor mental health, and poor mental health definitely leads to, bad physical health. People with depression can stop looking after themselves, and you kind of lose interest in things that you would normally like, such as running or whatever. So we really need to shift the conversation. So throughout the week, we will be sharing information and resources about where you can find support. We'll also be encouraging people to have these conversations. And on Friday, we'll be hosting a quiz just to kind of wrap the week off. And that will be general knowledge, but with some mental health questions thrown in. So if you want to have a bit of a laugh on Friday, feel free to join us for the quiz. So 4:30 on Friday. All the information about the joining instructions and how you can kind of take part will be on the website and social media. So head over there and save the date for that. But to kind of kickstart the conversation, I wanted to share with you some kind of key facts and figures really, such as the fact that 1 in 4 of us at some point in our lives will experience a mental health condition. It's much more common than people think. And I think that's partly down to the fact that it's kind of like a hidden illness, isn't it? It's not the same as seeing someone in a plaster cast or that sort of thing. And people who have lived with a mental health condition for a long time also get very good at hiding it. So unless someone is having a really bad day and is kind of showing it physically, you wouldn't know that they're having a bad day. So it is a lot more common than people think. In any given week, for example, 1 in 6 people report that they have feelings of common mental health conditions such as anxiety or depression. 1 in 5 people have suicidal thoughts, 1 in 14 self-harm, and 1 in 15 attempt suicide. And just to kind of show how much we need to kind of change the conversation about it, only 1 in 8 adults who live with a mental health condition are actually seeking support. They're suffering in silence, essentially. It's much more common than people think. And unfortunately, there are some groups who are impacted more by mental health. So the LGBT community, for example, are 2 to 3 times more likely to experience mental health conditions than their cis straight counterparts. People who are black ethnic minority are 23% more likely to experience mental health condition. Young women aged 16 to 24 are 25% more likely to experience mental health conditions than the other population. And suicide is the biggest killer of men in the UK under the age of 45. So there are certain groups who seem to be impacted more by mental health. And it's important to kind of stress that your identity, who you are, does not lead to or cause a mental health condition. The causes of mental health are very complicated, very complex, and sometimes just a range of different things come together in a perfect storm, and bang, you've got anxiety or PTSD, or you've got depression, or there's a whole range of different things behind us in our minds that happen to get us there. But for some communities, such as the LGBT, young girls, and black ethnic communities, there are some key factors that can increase the risk of mental health, such as social inequality, disadvantage, discrimination, social exclusion, traumatic experiences. All these things can trigger mental health conditions. So it's not because of who you are, but it's because of maybe the way that society treats you. So there are those kind of triggers. And at the moment, we are living in a climate of fear and high anxiety because of the current pandemic. You know, we know from working at Healthwatch that it does feel like the number of calls that are coming through around mental health and the conversations we're having with service providers, it does seem like mental health is starting to bubble up a little bit. It's too early, really, I suppose, statistically wise, to say if the pandemic will have an impact on mental health, but it would be highly, you know, it's kind of, I suppose, if you wanted to guess, I would probably, you know, it's probably easy to say that it probably will do. And it's probably a great time to start having this conversation, because all these things might seem like they're big problems that no one can resolve, but this year's Time to Talk theme is the power of small, and how small conversations can have a big impact. So although all these big problems, you know, the amount of people suffering from mental health, the issues we're having with the pandemic, they might seem big, and that we can't do anything about them. But having small conversations might allow someone to feel more open about sharing their experience and seeking support. It might help reduce the stigma. So having these small conversations, even if, you know, no matter how small or how big the conversation is, can have a really big difference to the way that people live their lives in the future. So, you know, as I say, throughout the week we will be sharing resources on where you can find support. You know, it is time to talk, and we should talk. So please check out our website for any information. And if you want to talk to someone, please call the Healthwatch team. You know, we are here to have those conversations as well.